Thanks. I think the session that was just preceding this is a nice introduction, nice segue. I'm going to make an announcement about something that we're doing that's going to go out to the wires now. And it comes about very much from what we were talking about, which is frustration at the limited options that most citizens have in terms of impacting their health. So one of those people you probably recognize, and one you probably don't. But don't ever think that they don't both care a lot about what is the potential in terms of what is disease, what is normal, how they could, how their life could be impacted. We're talking about the democratization of biomedical research. Thanks to a new grant from the Robert Wood Johnson Foundation, we've been looking at a project to ask why is it that patients couldn't simultaneously be able to be functioning as funders, as researchers, and as patients. And those are rules that in our society are generally separated, segregated, and so you go to funds, you get the funds, or the people that do the research, and then there are these patients that are sort of those that information sometimes is taken from, but they're not partners in that process. This project called Bridge has as its theme, imagine a way that actually the public, the researchers, and funders are actually working together on particular problems, and in those particular problems, all the data is shared. It's able to be seen by 1 million people who want to work on the data, and the results are going in real time back to those citizens. So the thing that I think I mentioned on the panel that I most worry about is the very large fraction of, I call it the equivalent of the corruption of denial. That is, those who really don't know to be asking those questions, who don't know to be engaged. And so the question is, how can you get citizens to actually really, in large numbers, be engaged more in their disease? So there are 3 projects that we're specifically moving forward in the first 2 years. One's on diabetes, and this project in diabetes is in Sweden, and it assumes that there are citizens who would be willing to do many things, wear remote sensors, run narratives, answer surveys, and see how far up that chain of giving information insights can they go in terms of the things that matter the most to them. So the concept here is, instead of the N+1, imagine that N+1 is hundreds of individuals who are watching each other's insights, watching each other's narratives, watching each other's objective information, and then there are researchers, who basically anyone in the world, that can have access to that and see whether there are patterns that take the anecdotal to a signal. So that's one of the projects running out of Sweden. The second project is a project going on in France. In Paris, there is an app on iPhone, on smartphones, that measures sleep cycles. 600,000 people have that app right now. Actually, it's close to 700,000. And people take their iPhone to bed when they're ready to go to sleep. And the accelerometer and the microphone allows them to look at what is that interval before they've fallen asleep, what is the type of sleep they're getting, and that's been in general use. Our thought is, why not turn that into a massive clinical trial machine? Why not make it so everyone who's using that app has the opportunity to say, I'm taking this drug, and I'm taking this drug, and why can't we enroll all those people in an online, continuous ability to track what it is that's happening to them? And I think what we'll find is many of the approved drugs actually are not working well for all, and maybe they're working for some really well, and maybe other ones need to be developed. So imagine that all that data will be hosted up in the cloud. Anyone in the world can look at that and come up with patterns, and think of that as a way to take drugs that are already on the market and ask, are they really being effective? Are they being used in the right ways? The third is in a small but one of the most passionate communities that I have come in contact with. This is children who have bone marrow failure, a particular type of bone marrow failure called Fanconi anemia. And these children, when they've been transplanted, and also, in fact, when they're not, have DNA repair defects such that they have a high risk of going on to get second malignancies. We did a survey, talked to people in the community, and they said, we're willing to give real-time data on what's going on in our lives, what's happening to us, give photos of our mouth in terms of this is where many of these head and neck cancers occur. And the idea is we're going to host all that data up again in the cloud, and I'll see again whether the occasional thought that someone has, well, this may be a risk factor, or this seems to be happening before, is better than that Sarah Rigori 1 hour with a physician a year. Imagine if you have continuous longitudinal information flowing in. You have the narratives. The community is part of that diversity that I think is necessary. So we're going to be running projects. You can see the similarity in all of those. And it is about what we think is going to be necessary if we could have what I feel as if we deserve, which is what does it take to build a contour map that tells individuals with a risk for disease when they're going in and out? If we can use GPS like this, why can't we have a medical GPS that's telling us, ooh, that triple cheeseburger might not have been the best thing to do twice in a row? And so I think the only way we're going to get there is by very much grassroots and recognizing that citizens, patients have so much more to offer than simply the information. And the last thing that I'll leave with is that one of the things that we've been really excited by is the use of challenges. So when we put this data up in the cloud, and we just did this for breast cancer, looking at the aggressiveness of breast cancer, put the data up, thanks to Google, up in the cloud, and people from 35 countries got on. Thousands of models were generated, and the winner solved the problem, was an electrical engineer, in a way that no one would have expected. So I think that as we go forward, the point I tried to make earlier was imagine the power of citizens not being voyeurs. Imagine the essential aspect of not having a local MD or a local nurse or a local friend trying to make sense of the N+1, but what happens when actually you can get to all of that data. And so I just want to thank the Robert Wood Johnson Foundation. I also want to thank the organizers and Larry Chu for letting this announcement be here.